what we call beta cells that are actually producing insulin to lower our sugar levels when it's higher. Now, the body recognizes then these beta cells as foreign, and then it destroys it totally, meaning that there is no beta cells at all, and there is no insulin at all to bring these sugar levels down. So at the end of the day, the patient or the person with this type 1 will remain with much higher levels of glucose in the bloodstream. And then type 2 is where there is actually impairment on how the body regulates and uses then this glucose as fuel, meaning that there is insulin, but the insulin is less or is insufficient, or there's a resistance then in the insulin. Therefore, as well, the sugar remains higher in the bloodstream.
Now, when someone has diabetes, what type of food should they be wary about?
When we talk about a diet with diabetes, we don't really say we prescribed a certain type of food that the people should eat. Because if we prescribe, then the person will not be able to afford those type of food. Right. So what we advocate is to eat less of the carbohydrates, because remember, when you eat carbohydrates, 2 hours later, it's going to turn into glucose. Now, remember, if you eat a carbohydrate, meaning that 2 hours later, it's going to be glucose, is to lower the amount or the portions of the food that they eat, and to also eat less food with less calories, because that is the energy that you are getting in, and the body at the end of the day cannot use that energy. So most of the time we advocate to eat mostly fruits and vegetables if they can afford, and then just to eat a small portion of the carbohydrates or the starches. And then when they eat protein, which is now the meat, just the size of the hand palm, like for chicken or for meat, and to avoid really saturated fats, and to avoid fizzy drinks. A lot of calorie intake should be reduced actually, and then also to drink a lot of water. Yeah.
Now, talk to us a little bit about some of the activities that are set out by the Ministry of Health and Social Services to commemorate World Diabetes Day.
Yeah, indeed, a very important day, 14th of November, is globally commemorated, and Namibia is part of the global village as well. So we started today. The day was officially opened, or the campaign. We are running a 3-day campaign where we are testing for free for diabetes. So the day was commemorated, officially opened by our Honorable Deputy Minister, Honorable Esther Munyangwe, and it would kick off also with screening sites. We have 6 sites where people can go for free testing. If I can just mention a few, we have the Windhoek Central Hospital, the Venue Park opposite the Woolworth. We have Okuliangava Clinic, Mahulili Clinic, and also Katutura Health Center, and then not to forget the Intermediate Katutura Hospital. And all these centers are open from 8 up to 5, and everybody is actually invited to go and test their sugars to know their numbers.
How was the response today?
The response was really overwhelming. I visited some of the sites, and people really came out in numbers. People want to know their numbers. They want to know their sugar levels. As we know that Namibia have 20% of pre-diabetes. So if we don't do now interventions, these people will turn up to be diabetes in the next 2 years.
Well, that's very encouraging that people want to know their status.
Yes.
How can members of the public then play a role in raising awareness on diabetes?
Yeah, very, very much important to partake and to participate when we are offering these free services. The citizens should really go out there, because the government is really trying its best when we are offering these free services. And also to be supportive. If we have a member of the family who's having diabetes, it's also for them to know and to read up also on these conditions, to be able to be a good support system to these patients as well.
Is there anything that you would like to highlight in terms of World Diabetes Day?
Yeah, just to encourage each and everybody really to come out and get tested, very, very important. And just to encourage my patients or the clients or people living with diabetes, I really have a passion for these people because it's not a death sentence when you are diagnosed with diabetes. Diabetes is a self-management condition. Take care of yourself, eat healthy, live healthy, exercise, and drink a lot of water, and they should really avoid high calorie intake like fizzy drinks and so on.
Right. Thank you so much for speaking to us this evening.
Thank you very much, and also thank you to the viewers.
Well, of course, I've been speaking to Hileni Samuel, a diabetes nurse educator at the Ministry of Health and Social Services, and of course, speaking to us about World Diabetes Day, which is today, the 14th of November. Well, up next is the global news roundup, so stay